February is Black History Month, and we'd like to bring attention to the importance of mental health because for generations, mental health has been stigmatized in Black and brown communities. So today, we're here to create space to make sure viewers know that strength and vulnerability can coexist. So let's talk about a new study here by the National Institute of Health. It finds that 20% of Black adults in the U.S., they report experiencing mental health challenges. And they often face higher rates of distress, depression, and trauma compared to their white counterparts. The NIH study also finds that the following 1 in 5 adults say that they experienced a mental health condition in the past year, with nearly 5% experiencing serious mental illness. Only 39% of Black adults with mental illness receive treatment. That's compared to 52% of white adults. And when it comes to racial trauma, racial discrimination, and police violence contribute to high rates of stress, anxiety, and PTSD. So joining us from Guidelight Health in Waltham is Dr. Chidi Wamuo to discuss mental health during Black History Month. Doctor, we thank you so much for being here with us.
Thank you for having me.
I can't wait to get right into this discussion because this is going to be some good information for our viewers this morning. So let's begin by talking about why conversations about mental health are so important, not only this month, but every day.
These conversations are important, not only, as you mentioned, in Black History Month, but every day because, particularly in this month, it allows us to take a pause and reflect on how the Black experience in America has shaped health outcomes. And as you talked about the statistics and research demonstrating African Americans are less likely to receive mental health treatment. And so as we have these discussions about mental health, it encourages those in the Black community to speak about it, but also the institutions that provide care to do the same.
And the more that we can get people talking about it, talking about the resources, normalizing, having the conversations and knowing that it's okay to get help, that's the goal. That
is the goal.
Now, mental health and physical health, they are hand in hand, and all of this, the thought process around this, it starts at an early age. But why is it important to recognize that?
It's very important to recognize that, especially at an early age. Children and adolescents, their bodies, their brains are growing, but they're also vulnerable. So where children and adolescents live, eat, work, and play can have a direct impact not only on their mental health, but their physical health into adulthood.
And when we're talking about access to these resources and the mindset, we're also undoubtedly talking about equity. Can we talk about why equitable care is important for all communities?
Yeah, well, firstly, equitable care allows society to thrive. And when there is inequities present, people are not able to function as they would rather have. And so it's very important, regardless of race, gender, or even insurance status, for everyone to achieve the care that they deserve. And when we don't do that, we see the disparities that we highlighted, higher rates of family struggles, substance use, incarceration, and the rising levels of depression and anxiety.
And another big part of this conversation that I think sometimes gets left out is the importance of community. Community is important from the time that we are children through the times that we are adults. Can we talk about why we think maybe that's kind of gotten lost in the conversation a little bit?
I think it's gotten lost in the conversation because we're focusing a lot of the time on medications. But community is essential because it can balance out adverse experiences children and adolescents go through. And having one adult in a child's life that takes interest in them could be far more powerful than any medication that a doctor can prescribe. And so at Guidelight Health in our clinics, children and as well as adults have access to therapists, doctors, client services coordinators that serve as touchstones that validate these children and adults' experience, and that is very powerful.
Now, in your experience, do you see positive change in Black and brown communities in accepting and speaking out when it comes to mental health issues?
I do. I'm finding more conversations are being had in Black communities, and there is less stigma. And so as more African Americans and Black individuals seek care for their mental health, it's vital that institutions, hospitals, clinics have a knowledge of the Black perspective when they're providing care, and also the humility to continue to address the health disparities that we've been discussing.
Now, you know, we can't have this conversation without bringing social media into it because everyone's got a phone in their hand, a tablet in their hands, right? And people are turning to social media these days for all of the answers, and maybe if not all, at least some. I think that initially people think that that is a negative. Do you think that there are positive and negatives when it comes to maybe turning to social media in terms of your mental health?
There are positive and negatives, but especially children and adolescents, it's important to have a balance. And I recommend parents, caregivers, teachers to really set limits on screen time. And so that there is a balance found, and so the negatives do not outweigh the positives. And the negatives, we're talking about bullying, exposure to violence, exposure to other instances that are difficult for children to navigate.
Now, in addition to decreasing that screen time, because I think for parents, sometimes that's easier said than done because the kids know how to use all the things better than the parents. But is there any other tools you can equip parents with when it comes to kind of helping them to minimize their exposure to social media?
I would say prioritizing family time outside of social media, sitting down, having conversations at the dinner table, going outside for walks. But in addition, if children are going to be on their phone, using parental controls, caregiver controls that can block access to certain sites, and also having conversations about what children and adolescents are seeing on these platforms and trying to figure out the best way to navigate it.
So now I always think it's important that when we give our viewers all of this wonderful information, we got to make sure they know where they can find help. So give us that important information.
Yes, all those listening can find help at guidelighthealth.com. And we are here. Everyone has a seat at the table at Guidelight, and we work with all insurances, including Mass Health.
Oh, see, that's an important part, because sometimes it's the insurance that keeps people from getting help because they're like, how am I going to pay for this?
It's an unfortunate reality, and I'm very grateful and proud of Guidelight to taking the stand of not limiting due to a particular insurance coverage.